Hey guys, I'm Combat Craig, and today I'm going to have a medical doctor help me explain VA disability ratings for knee conditions. We're going to start off by talking about some common problems that veterans have in their knees, and then we'll discuss how the VA rates knee conditions using both the old rating criteria as well as the new rating criteria that went into effect in February 2021. If you're interested in learning how to put yourself in the best position to level up your VA claim, I'd sign up for my boot camp at combatcraig.com.
So I'm going to use osteoarthritis as my illustrative condition today. So obviously you can have lots of different problems in your knees. Osteoarthritis is very, very common. So I'm just going to use that to kind of illustrate a bunch of points. And so what is osteoarthritis? So it's, degeneration of the joint in general, and then specifically the cartilage gets degenerated. And you start to form these things called osteophytes, which is basically new bone, where there's not supposed to be bone. So it's kind of on the edge of the joint, and you can kind of see it in those middle pictures there. It's growing like it's not smooth along the borders of the bone. So the subluxation that I mentioned I was going to talk about, there's a picture of that in the third row of images there. There's kind of a cartoon depiction of obviously the femur is not over the tibia straight up and down there. And then you see the same image on the x-ray. So that is subluxation, where it's kind of like severe movement of the joint out of its normal planes. Degeneration, like what does that mean? What does it mean for it to be degenerating? Okay, so let's just scroll down a little farther and we'll show this is showing a hip, but the same principles apply. Okay. So this is what a nice new joint in like a teenager looks like. Okay, so you have cartilage that overlies where the bone is interfacing in the joint. So basically the tip of their femur and then the upper side of your tibia. Okay, so the edges of the bone have cartilage. You also have cartilage inside the joint. That's called the meniscus. This is early changes of degeneration. It's starting to get kind of hairy, and it literally is getting kind of hairy. So the cartilage is starting to break down. The bone underneath the cartilage is starting to get thicker. And then over there where it's showing the hip joint, but same principle for the knee joint, the space between the two major bones in the joint is narrowing. And so if we could keep scrolling down, it just keeps getting worse. The cartilage starts breaking off. So you've probably maybe had an arthroscopic surgery on your knee where they went in and they took some stuff out, and you're like, how did something get in there? I didn't put it in there. Well, it broke off of your bone. Okay. So, and then you can see the bone getting thicker, the joint space continuing to narrow. And then the last picture, is what we would refer to as end-stage arthritis. So there's almost no cartilage left on the bones. The bone is starting to look all messed up with cysts in it, and then and there's almost no space in the joint anymore. So this is what people refer to as bone on bone.
Before we get into the new changes to the rating criteria, I want to take a minute to give a shout out to the sponsor of today's video. Hill & Ponton is an accredited VA law firm out of Orlando, Florida, and they've been fighting for veterans for over 30 years. If you're considering lawyering up, you might want to head over to hillandponton.com to see if they can help you with your appeal or TDIU claim.
Okay, now that we have these processes that are happening in the knees, how does the VA actually give you a percentage? As of this moment, you have to look in two different documents. They just changed in February 2021 how they rate some of the knee conditions. And so we're going to look at the old document first. There's that genu recurvatum that I was talking about. So you can get 10% for that if basically if your knee hyperextends. So that's that. Okay, so I'm not going to talk too much about ankylosis. What that word means is that your joint is ankylosed or fixed. Okay, like it's like bent permanently. Okay, kind of rare. Okay, because if you're in that situation, then they'll just replace your knee. Okay, you don't really see those ratings that often, so I'm not going to talk about it. The part that's lined out, the instability, that got changed. So we're going to talk about that in the next couple pages. The stuff that stayed the same, didn't change in February, would be the ratings for cartilage, 5258. You can get a 20% for that. Or if your cartilage is removed, you can get a 10% rating. So you might be wondering, like, okay, they removed my cartilage. Isn't that worse? Well, no. Once they remove it, you actually have some relief of your symptoms, because when the cartilage is in there and it's all, kind of gumming up the works.
If you get value out of these videos, please consider subscribing to my channel and hitting the like button. Also, let me know what you think about this video by leaving a comment below. And if you don't like this video, make sure you hit that dislike button twice.
So moving on to the really important rating, 5260 and 5261. Okay, so 5260 is flexion and 5261 is extension. Okay, so the two things that I mentioned earlier. So you can get up to a 30% rating on flexion, but you got to be pretty darn limited on flexion. And then for extension, they have numerous ratings there. They have 6 of them, and you can get up to a 50% rating. Okay, that basically you can't straighten your leg. Now, okay, so you're probably wondering, like how in the heck would I ever get a 50% rating for extension? Or, I did my C&P exam and all I got was, 0 or 10% for flexion. So this really comes down to a big difference between active and passive range of motion. I'm going to discuss that in detail later on, okay, because it makes a big difference. Active range of motion is basically measuring your range of motion under load, okay, like with weight or resistance. And then passive would be like you're just kind of moving your joint without any resistance. Well, as you can imagine, there's a big difference between those two things. It's my personal experience of attending C&P exams for myself and talking to hundreds of veterans who have described their C&P exams to me, that C&P examiners often, almost always, only do passive range of motion. They make no attempt to do active range of motion, and they're actually required by a court precedential decision to do so, and actually by a regulation, 38 CFR 4.59. So, but they just don't do it. They just don't. Something to look out for. Yeah. Yep. So now I'm not telling you to like get in a verbal sparring match or a fist fight with your C&P examiner, because that's not going to be real productive. They generally don't like to be told how to do their job, and certainly wouldn't want that to affect your rating. What that means is that after the C&P exam, you can write a statement or something saying, hey, my C&P examiner didn't do their job. So now we're into the new stuff. And you're like, oh my gosh, this is a lot of yellow on the screen. And it is. Okay, because they made the instability rating super complicated, in my opinion. So basically, they make it a lot harder to get that 20% or 30% instability rating. It used to be kind of this nebulous mild, moderate, severe system. And so they've basically defined those, which in reality is probably appropriate. So anyway, I am going to go into a little bit of detail on this because this affects a lot of people. So this is the 5257 code. This is a new part of the 38 CFR 4.71a. Subluxation or instability, I'll actually show you the definition of those a little bit later. It comes out of the M21-1 manual, which is a VA internal document that is a guide for the raters. So the 30% rating, so that's real bad. So that means you have a complete ligament tear. So that would be of the, there's 4 ligaments in the knee, okay, that all keep the femur and the tibia kind of stable on top of each other. So the 30% rating, unrepaired or failed repair of complete ligament tear. Okay, so that's pretty bad. If a surgeon kind of tries to repair your ACL or your PCL and they fail at that, or they haven't fixed it yet, I mean, your knee's probably going to be pretty darn unstable and giving out on you. And so here's an important point. And a medical provider prescribes an assistive device like cane or crutches or a walker and a brace. Okay, so you got to have a lot of stuff going on for that 30% rating, that your knee's just totally messed up, very unstable, and you have to have a cane and a brace. All right, so that 20% rating, this gets even more complicated. Okay, so it's one of two situations. One of the following is you have or A, as it reads, is a sprain with an incomplete ligament tear. Okay, that makes sense. It's not torn all the way. Or you have a repaired complete ligament tear. So you tore it completely, but you got it repaired, but you still have some residual instability. Okay. And then, that those kind of make sense. Like why those would all be falling in the same category. You either repaired it, or it's an incomplete tear, or you sprained it really bad. Okay. And medical provider prescribes a brace. You got to have something wrong with a ligament or a bad sprain, and you've been prescribed something, a brace or a cane. And then and then just to make it more complicated, just to cover all their bases, okay, you have an unrepaired or failed repair. So same thing as up in here in the 30%, okay?
Mm-hmm.
But the difference is you've been prescribed a cane or a brace. Okay, so it's the difference between both and or. Okay,
Mm-hmm.
so just covering all possible situations, I suppose.
Yep.
Okay, so moving into the 10% range, we've got a sprain, an incomplete ligament tear, or a complete ligament tear, repaired, unrepaired, or failed repair. Okay, that's basically anything. Okay.
Yep.
Causing persistent instability with no prescription. Okay, so cane or brace. So maybe you went to Walgreens or CVS and bought yourself a cane or a brace, and that helps you a lot. Well, okay, that's not going to help with your rating because it's not prescribed. Now, just because a doctor prescribed from the VA maybe gave you a certain cane or a certain brace and you don't like it, well, that doesn't mean you have to use that one. You can use the one that you like, but they just did the prescription. What they're talking about here, the important thing is the prescription. Basically, it's in your medical record that a medical provider is telling you to use this device. So that's basically a very detailed breakdown of the 30, 20, 10. Okay. So what that means is that in practical terms, you can get that 10% rating, okay, pretty readily. Okay. Like somebody comes to see me and they don't have anything in their medical records for a prescription for a brace or a cane, I can still advocate for them getting that 10% rating because, I can say they have a sprain, because that's an important point on that 10% rating. You don't have to have imaging like an MRI of a complete ligament tear or an incomplete ligament tear. It could just be a sprain because maybe you hurt your knee, 10 years ago, and now it's unstable, like it gives out on you. But for whatever reason, you have not, required an MRI to diagnose the status of your ligaments. You could still get a rating for instability. So they made it kind of complicated, but overall, like from a doctor's perspective, this is actually pretty well done. Okay. Like I thought that the old way of rating it was probably giving a little too much rating. This, is kind of like modern medicine here. So moving into patellar instability, I'm not going to discuss this too much because the regular instability, like of the main knee joint, that's pretty darn common. Patellar instability, not so much. So there's a 30, 20, and 10. Okay. It actually has to be diagnosed. Okay. Which they don't make that distinction up here for the regular one. And so, similar system, surgery, brace and a cane, just a mixture of braces and canes and surgery and stuff like that. Okay.
Yep.
The patella is the bone that's overlies. It's your kneecap. Okay, just for simple term. Okay. Um, okay, so that's patellar instability. And then the other thing that changed that I'm just going to briefly mention, but it's important if you have this disease, is code 5262. And that now there's a separate diagnostic code for Shin splints, also known as medial tibial stress syndrome, MTSS. So that's the fancy word for it. Okay, so because this now has its own diagnostic code, that means you can get a separate rating. And I'm just going to briefly mention this. It used to be that shin splints would get rated on how they affected the knee or the ankle, and most often C&P examiners would associate the shin splints with the knee. And so basically, your shin splints would get pyramided up with your whatever problem you had in your knee. Well, now you can get a separate rating for them, which I think is very appropriate because shin splints, don't really realistically bother your knee or your ankle. They bother your shin.
Right.
So, like I used to have shin splints, so I can speak to this. Talk about the knee replacement. I'll just do this real quick. The big change here basically used to be a year that you would get for a knee replacement. Now it's 4 months. Yep. Okay. And then, just in case you didn't know, it used to not really be a year. It was actually 13 months convalescent rating, as they call it. So while you're healing up. So basically, they this in my mind is appropriate. It doesn't take a year to heal up from a knee replacement anymore, like with modern surgical techniques. So I think it's appropriate. In case anybody cares. But you get no matter like say you had 3 ratings before for flexion, extension, and instability, those all go away, and then you now get a single rating under 5055, which generally speaking is appropriate because you've all of that stuff that was causing those other problems has been replaced. And so the minimum rating, the actual minimum rating is 30%. So that might represent a reduction. So you might have like a 30, a 20, and a 10 for your flexion, extension, and instability ratings. Then you go up to 100 for your knee replacement for 5 months, the 1 month after the hospital, and then 4 additional months. It says that when an evaluation is assigned for prosthetic replacement of a joint under 5055 is included in there, an additional rating may not also be assigned for that joint unless otherwise directed, which would be like a very special situation that I've never seen happen. Right. So basically what this is saying is you get 1 rating for the joint. Okay. Now that's largely going to be appropriate because most people, the knee replacement is successful. Orthopedic surgeons are highly trained and they do a good job. Some people still have a lot of residual pain and stuff associated with their knee replacement. And so I've seen that a number of times. And so they get a 60% rating. Like basically if your knee is still really bad. So chronic residuals of severe painful motion or weakness. So that does happen. Usually those people who are in that state get offered a revision surgery.